work. And then I have to remember to hit record as well. So we're just preparing the live stream now. And if I can grab that link for you, in case, I don't think we'll get over 100 people, but just in case we do, we probably would like to share that, that link. So I'm going to go ahead and copy that link. And before we hit record, I'm going to put that in the chat in case you have team members who can't make it. Okay, there is the link there. And yeah, that's good. Gretchen, could you put that link in the Path Training Team customers and distributors group? Just let them know we're going live. That would be awesome. Thank you so much. I'm going to go ahead and make Mary our host, or co-host. And then I'll also, yep, I think, let's see if your audio is working, Mary.
Yeah, I think it is.
Yes. Awesome. Okay. Yay. Okay, so I'm going to hit record and I'll let you start, Mary, with your introduction. Hang on just a sec. Here we go.
Hey, everybody. I'm Mary Perry. I'm here in Maryland, and I love these sessions with Dr. Karen. They're always informative. So if you type your questions in the chat, please make sure that you're asking about symptoms, not about disease, and we'll get to them as we go on. I know Dr. Karen is going to talk a little bit tonight about post-COVID, what is it, post-COVID?
Long haulers. They have a title, long haulers, I guess they're called. But we're going to be talking about the symptoms and how we can hopefully make those better.
Yep. So, so that's, I'm glad to see some, I have a new preferred customer here tonight. And I know I've got some other folks from my team, so I'm really excited about that. So yay,
yes, welcome. I'm just gonna lower my table here just so you can see me better. Oh, that's okay, great. That's fantastic. Yeah, Mary, tell me, from your perspective, give me a story. Like, I know you have quite a few folks you're working with, and
lots, yes. So after Christmas this year, I kind of half fell and hurt my back, and it kind of really snowballed. And so I was really kind of hurting for almost 4 months. And finally, I don't know why I didn't think of it sooner, but I asked the team here for ideas about patching protocols. Well, once they gave me the advanced back healing protocol, I did that for about 2 weeks. And oh my goodness, my back got way better, way quickly. I am without any braces today for my foot and my ankle. I do have a brace for my ankle I wear if I'm going to walk a lot, but I really don't have pain today. My back feels stronger and I'm pushing forward. So that's really cool. And thankful to the patches because they're amazing.
Oh, thank you so much for that story, Mary. I know it's been, it's pretty severe stuff, that you were dealing with, with the falls and things like that, on top of, when I first met you, disc stuff and, and then you were able to walk a lot after that before, the recent stuff. And of course, like this year, and last year with the pandemic and everything going on, like, who here thinks there was no stress related to that, right? Like, no one puts their hand up. Like, there was just so much undercurrent of stress that those of us, like Mary and I, are both healers, professional healers, right? Like, we can feel the weight of the world sometimes in our bodies. Yeah. The empaths, right? We can feel it in our body. So for some of us, it's, an extra bit of responsibility, or a lot more responsibility than the average person. So I know sometimes I used to go to my parents' house and have all these empathetic symptoms, especially back then. And one time I had this migraine, like, oh my gosh, and basically my family said, look, why should we even listen to you? Like, you're not doing any better. And I was like, oh God, right? But I was like, you know what? So I did energy healing work and patches and the whole bit. And it just, I got rid of the migraine. But it was as if nothing happened. Like just, they just forgot like what they had said, right? And I was like, oh, sometimes I better watch what I say in front of my family. But actually, luckily now, um, you know, uh, yeah, I probably feel the healthiest I've been, and I may have a niggly issue here and there. But just remember, like, with what Mary and I are doing, literally on a daily basis, like we're helping to heal the world here,
Absolutely.
yeah, so it's really challenging for us, and for us to have these energy tools um is important. It's not to say that at some point in the future we could just magically snap our fingers and be, I call it Jesus healing, right? And sometimes that actually happens today. But but when it comes to our stuff and our responsibilities, sometimes we need that support.
Yep.
And that's completely, yeah, completely fine. Anything else you wanted to
Yeah, a
share?
funny side note, I actually went to the doctor's today for my foot. It was my last checkup for the tendonitis. And I forgot I had the ice waves on my bottom of my feet. Do you know he didn't even ask me about it? I was shocked. I was shocked. He must have just thought, oh, she's just loony. So, because I was talking about using oils on my foot and stuff like that. So I just went,
Oh.
okay, yeah, it's all good. He went, nope, I'm not going there. So
Oh, that's funny.
I
Well,
know.
and the interesting thing is that, people would say, oh my gosh, there's, like, what if I go to the doctor and what if they're suspicious, whatever. And, sometimes, I mean, sometimes I'll just say, just let them know it's an acupressure patch. Because we
Right,
used to kind of call it that in the old days, right? And they're
right.
like, yeah, whatever. Like, they don't care. It's like,
Yeah.
it's an acupressure patch. It really helps me. Oh, okay.
I mean, I don't mind talking about him, but he lifted up my foot to look at my foot, and I went, "Oh, I have patches on," to myself, but he never asked. So
Yeah, you wonder if he's really even paying attention.
exactly, because basically what he told me today was I have arthritis, and my feet aren't going to get a whole lot better. Basically,
Oh, phooey on them.
I know, I know.
Yeah. Yeah. Sometimes you just take everything with a grain of salt because and I can say this because I'm a medical doctor, right? Like some things we just don't know. Like the
Right.
stuff that functional medicine doctors know and naturopathic medicine doctors know, we were never trained on. We got like what, on average in North America, 2 days of nutrition, and I fell asleep for both days. So what does that tell you?
Yeah.
I had to learn all that stuff later on when I got sick with
Exactly.
fibromyalgia, chronic fatigue syndrome, Hashimoto's thyroiditis, right? I was on thyroid pills before. Yeah, like the list goes on. I got multiple chemical sensitivities, allergies, gut intolerance, gluten intolerance. What else did I get? Yeah, leaky gut, joint issues. Yeah, but it's neat because these things are reversible. So I'm excited to share with you a couple of ideas. I'm talking them ideas because it's not like there's a set protocol per se to treat the symptoms of COVID long haulers, but we're going to kind of dissect a little bit in a simple way, just what symptoms they have and then which patches may be really helpful for the symptoms. So I'm going to give you like two protocols, but I really want you to understand that this is not written in stone, that you can try different things. I'm just trying to give you like a general idea of how I would approach it. And then each, whoever you're working with or yourself, I know Joy mentioned, that she had some stuff going on. So you try things out, what works, what doesn't work, until you find the formula. But the reason I'm here today is to say, hey, there's a lot of leeway. You can play with these patches, and just like we did with Mary, we had to give her an advanced protocol because she had tried all the simple ones already, right?
Exactly.
Oftentimes you don't have to go to it. But hey, you know what? COVID long haul symptomatology is pretty severe. So I am going to show you a more complex protocol today, but just so you know, it's not written in stone. If you're part of our, patch training team, customers and distributors Facebook group that I manage, you're more than welcome, to post underneath this video. We'll post the video there after, and just say, hey, I tried this. This didn't work. What else do you suggest? That kind of thing, and that's completely fine. Just remember to tag me, Karen can, so I remember to respond to you because otherwise I might not see it. Okay, so let me see. I'm just going to remove your spotlight here just for a moment and share my screen. So I've got some pictures for you. Okay, well, let's start with this one here. So hopefully you can see my screen. Yes?
We can, yes.
Okay, fantastic. That's great. So, according to the CDC, the most common lasting symptoms after COVID are fatigue, shortness of breath, cough, joint pain, and chest pain. Other issues including cognitive problems, which means brain issues, brain fog, or just like not thinking straight, difficulty concentrating, depression, muscle pain, headache, rapid heartbeat, and intermittent fever. Now, what's really interesting is that COVID is very different from most viral infections. Most viral infections, you know them because they have a lot of phlegm. You know,
Mhm.
there's a lot of goop. But with COVID, you don't get that. And there are so many different things that may be attributable to, is that a word? To like blood disorders that it's like this is a very weird virus. Like it causes like blood disorders, like and the oxygen, people can't get their oxygen in. And so when they go on the ventilator, they don't do well. Whereas normally, if you put someone on a ventilator, you plan to get them off, right? And that wasn't happening, at least not at the beginning. So there's a lot of weirdness, with this particular thing. But what we're going to focus on today is like these symptoms. So let me go through these one at a time to give you an idea. So let's start. Actually, I'll annotate this because it'll be easier to know. There we go. All right. So fatigue. All right, let's talk about fatigue for a little bit. So in Chinese medicine, fatigue is not enough qi. Okay, so not enough juice, not enough energy. So it's like your battery is worn down. Well, that makes sense a lot, right? Because this can be a severe, symptoms from COVID. And so that post-COVID fatigue, what does that mean? It means that your batteries weren't full when you started with it, because there's plenty of people who hardly noticed anything.
Mhm.
They were like a little cough here and there, a little fever, they were done. 2 days they were done, right? Children, like great survival rate, they hardly have anything. So they call them asymptomatic carriers. But fatigue is your batteries being low. So in our protocol, we're going to show you some ways of recharging that battery. So I just want you to think that your battery may have been low before you got COVID, which might have made you get COVID because when your battery's low, everything else is low. Your organ energy is low. There are instrumentation that people can use and LifeWave has used a lot of this with Dr. Sherry Greenberg and other scientists to measure these electromagnetic frequencies and how much, how charged up are the organs. Now, in Western medicine, fatigue is you can't make ATP, which is the molecule of energy. And there's a lot of what are called mitochondrial illnesses right now. Like, just so many people have it. So that's when your mitochondria, which are the little batteries inside each cell, aren't producing the ATP. And it's very interesting. I won't go into the, complexities of mitochondrial issues, but just so you know, we have some data out of LifeWave research that energy enhancer patches support, better mitochondrial function, which is super exciting. So we're going to talk about that in a moment. So here where we have shortness of breath, cough. Okay, so we've got some lung channel, issues there. Joint pain, chest pain. This is really interesting because this could be the lack of movement of lymph, especially the joint pain. It's like the toxins are not getting out of the body efficiently. And so you can have joint pain. Before, when I was very sensitive to uh, cheese and stuff like that, I didn't know because I was Western medicine trained that I probably shouldn't be eating cheese when it's raining out because, my joints wouldn't feel very good. And because I didn't have enough chi either, I didn't have enough energy, so I couldn't get rid of that damp fast enough. Now, cognitive problems, you know what? Most minor, my sense is a lot of this has to do with not enough chi. If you have a chi deficiency, you cannot think straight, literally. So it may or may not be a brain issue, although if it is a cardiovascular issue, if it is a blood disorder, that could, of course, affect the brain as well. So all this difficulty concentrating, depression, those three things can also be lumped under fatigue, under that umbrella of fatigue. The muscle pain, if you can't generate enough energy, you can have muscle pain. Also, if your lymphatic system isn't really working, you can have muscle pain, headaches. It's kind of vague headaches, but a lot of people do have headaches related to that. In Chinese medicine, they talk about things not being grounded, and the fire, if you will, kind of going up into the head area. And then, of course, we have some other heart issues here, and we talked about fever, which is fire. So let's move on to our protocol here. Okay. Next slide. How do I get there? There we go. Okay, so one of the protocols I created, I call the Restoration Protocol 1, where our focus is energy, immune, and brain. And like I said, some of these are very flexible and interchangeable. So it's just the principles of where we're patching I want you to pay attention to. You don't have to do it exactly the way we have it on this page. But I'll tell you why I chose what I chose. Now, again, this is going to be a more complex protocol than what you normally would start with LifeWave patches. So when people are brand new to LifeWave patches, oftentimes we'll start with one type of patch, usually X39 first for a couple of days. Then we'll add the next one, usually Eon, and then the next one, Energy Enhancer, then the next one, glutathione. Usually glutathione I leave to the very end because it's a very potent detoxer, but it's also very good for the immune system as well. So just in case the person, might not have enough energy to detox, I leave glutathione, the last one, to add in. But for those of you that have like, oh yeah, I've tried a whole bunch of patches, I'm good, don't worry about detoxing, you can do it all at once. So let me show you how this works. So this is a daytime protocol. So we're going to start here. Let me go ahead and put my drawing on again here. That's stupid. Okay, so here we have X39. Now, X39 works on the whole body. It helps activate your stem cells, and we want repair, right? Because some of this, like the lungs, the brain, might have been damaged related to COVID. So what we want to do is get the body to make those cells, to rejuvenate, regenerate, those cells. So one of the points in the brochure for X39 for the stem cell patch is actually underneath the belly button, about 2-3 finger widths below. And that is called conception vessel 6. Now, why do we use that point? Well, this is the classic acupuncture point for energy. If you're going to use a single patch, this is a really great point. That's like your storage area of energy, your qi storage, if you will, is there in your dantian. In Chinese medicine, that's what it's called, in the belly area. As an aside, I always thought it was very interesting that some of the Buddhas, that you see in Chinese art and mythology, they're very fat and they have a big belly, but they're very happy. So, my belly sticks out. I'm just like a happy Buddha.
Mm-hmm.
Okay, so CV6 we're using with X39. It works on the whole body, but we are purposefully using that point to tell the body, hey, store energy. Okay, and we're going to access that here. So next, let's go to this point here, the Eon. Now, the Eon is for stress and inflammation, and a lot of the symptoms related to the COVID post-COVID long hauler is related to persistent inflammation, right? That fever, right? That persistent inflammation, pain is a form of inflammation as well as blockage of energy in Chinese medicine. So why this point? Well, you don't have to use it on this point. But anecdotally, what we found is this point at the back of the neck. So everyone just feel the back of your neck for that bump. That's the C7 spinous process. Oh, did I hit record, guys? Yes, I did. Okay. So just had a little thing there. Okay, so on the back of your neck, I like this point because it's in the center line. And why do I like it in the center line, just like X39 in the center line, is because when we look at their energy enhancer patches and where we're going to put them, guess what it makes? Nice big triangles. And these triangles amplify the coherence of your body. It's like these pyramids spinning in your body. So this is big time helpful. The sacred geometry can help in the body's, oops, that's a terrible, sorry, there we go. Biocoherence. So this is also a brain balancing point. So if you've been on a team or a customer for a while, you may have seen the student portal for the principles of patching, where we talk about the various different points. I usually use one of the 5 brain balance points. So this helps your nervous system kind of get on track. Because if your nervous system is kind of wonky and stressed out, or the opposite, like too much relaxation, you can't really heal efficiently. So this brain balancing point really, really helps. And for people that have pain in the body, we actually find that sometimes just putting an Eon patch on the back of the neck reduces the pain in the entire body. So that's the other reason we're using this point. Okay, so we've got our X39, we've got our Eon. So now let's talk about the energy patches. Now remember, this is a restoration protocol. This is for people that have been really sick and are still feeling crappy, and we want to get them as quickly back to normal, even maybe better than before they got COVID, because they wouldn't have got COVID if they were healthy. So we want to really not just reboot the system, but put more energy in. So energy enhancer patches, in the principles of patching training, we talked about double patching protocols. This is one of those. Okay, so we're using 2 sets of energy enhancer patches. Energy patches come in a white and a tan, which is different for some of the other patches we'd already talked about that just come in one single patch. So the white goes on the right, the tan goes on the left. So let's start at this point down here. This point is at the bottom of the feet. Now I'll show you in the next picture where exactly on the bottom of the feet, white on right, tan on left. This point, kidney 1, is called bubbling spring. David Schmidt, who created these patches, is one of his favorite points to use energy enhancer patches. And since he said that, I started using that more often as well. Think of it as very grounding. Remember, we talked about people having headaches, right? So what we're doing is we're putting patches down below. So we're pulling some of that excess, chaotic energy down. It's very grounding. And that kidney point is like core energy, like kidney points, kidney 1, kidney 3, very important points for core energy. In Chinese medicine, normally we would use acupuncture, but nobody wants a needle on the bottom of the foot. I can tell you that. Yeah, I have one acupuncturist that she does it all the time. I'm like, really? Your patients come back? I never did it. I didn't dare. I was like, oh my gosh, that's so painful. But with patches, it's so easy. There's no needle, right? And you get like 12 hours of charging your battery back up. The X39 charges your battery for sure, but the energy enhancer also charges your battery. That's where we have the data, the mitochondrial support, etc. Now, the second set of patches goes on the upper body. Why? Because in anatomical position in Chinese medicine, the arms are above the head like this. Okay, if you're looking at my picture video like this. So when you have patches on the upper arms or the body, upper body and the lower body, you're actually creating multiple triangles that spin, which is really, really interesting. So for the upper body, I couldn't find any cartoons that had their hand like this. Anyway, so on the upper body, we're using triple burner 5. So I want everyone to actually find that on yourself right now. So triple burner 5 is 3 finger widths up from your wrist crease on the back of your hand. Now notice if you put the patch on here, 3 finger widths, and then you turn your arm around, it'll look like it's in the wrong spot. Don't worry about that. Don't worry about that. Just go, okay, triple burner 5, 3 finger widths up from the wrist crease. I'm going to put it right where the 3rd finger is, right between the bones. White on right, tan on left. Why this point? Well, triple burner 5 actually helps to activate your Wei Qi field. The Wei Qi field is the Chinese medicine explanation for your energetic immune system. It's one of your non-physical immune systems. Bet you didn't know that unless you took my other class. So the energetic immune system can be supported through triple burner 5. So we're going to patch both sides, white on right, tan on left. So now you've got double energy enhancer patches. We're restoring, the energy back into the body. And then you've got the repository of energy on the belly. X39 is going to treat the whole body. Eon on the back of the neck to help balance the nervous system, get the stress and inflammation down. And then last but not least, but this is optional, and I would add this in last, is the glutathione. I actually would, I say optional, but I would highly recommend it. But you want to just add this last, right? So you ask the other ones first, and then if you're doing okay, then you can add the glutathione. Now this patch here, actually it's a little low. Hang on, let me just, I'm just gonna escape here for a sec and just fix that, sorry. Okay, So this point is going to go up here. I'd copied the other slide, so there we go. Okay, that is better now. Okay, so the glutathione, the reason I have it up here, now I did have the center of the chest, but we have a different protocol for that. The reason I have the glutathione up here is because it's right over the thymus. So if you think about your breastbone being about yay long, it's the upper third. It's like the manubrium's here, your sternum's down below, but it's like 1/3 of the way down from this notch in the neck, 1/3 of the way down. So does it have to be perfect? No, no, no. Just put it somewhere in that area. It's good enough. If you're a little low, you're treating the chest. If you're a little high, you're treating the thymus. So it's all good. The glutathione is there to help with immune system and detoxification. So let me show you the next. Okay, so that's one of our protocols. And on the bottom of the feet point, kidney 1, bubbling spring, white on right, tan on left. If your foot is bare and you can feel it right now, you can actually feel that there is a depression. Here are your metatarsal bones right here, and there is a depression underneath it, just at the beginning of your arch. So this is where the kidney 1 bubbling spring is. Now, the second restoration protocol, I call it restoration protocol 2, is focusing on energy, of course, because we definitely need energy for the post-COVID, long haul to support them, but also a little bit more on pain relief and focusing on the heart. So for pain relief, what we're going to do is do part of the whole body pain relief protocol. And interestingly enough, it's the same point, kidney 1 down here. So kidney 1, white on right, tan on left. The LifeWave is for pain, and it actually has a white and a tan, just like the energy enhancer patches. So that goes on the bottom of the feet, like in the picture we just showed you. Okay. Now, in this case, we're doing energy enhancer patches as well. And I've picked this point on the wrist, which is almost opposite to the triple burner 5 you just learned. So if everyone goes like this, so on the inside of your wrist, 3 finger widths down from the inside of your wrist, in between the 2 bones, pericardium 6. Pericardium is the heart protector. And we've had some great studies with energy enhancer patches on heart rate variability, that patching energy enhancer patches with this point supports a healthy heart. So this is great news. So that's why I've used that particular one. And actually, it's very calming for the nerves as well. So pericardium is really helpful for kind of like, just feeling more calm or centered. It's also a great point to help support the heart rhythm. So if someone's got irritability in their heart rhythm, that's really, really helpful. And then also to support the heart, we've got X39, which of course works on the whole body. But what we're going to do is actually put it right in the center of the chest. And I want you all to even if you're listening to the replay, to find it on yourself. So what you want to do is just take a finger, third finger, and just poke down your breastbone until at around the spot between the nipples. Especially in guys, it's a little easier because girls, our nipples can be like different places. But poke down until you feel a really tender spot on the bone. Okay, do that right now. Where's mine? Here it is. Well, I just did block therapy on my sternum, so everything's sore. So that's a little challenging. But yeah, so what's a great thing about this point is that it opens up the entire chest. So we're talking breathing better, we're talking heart support, right? So this is a great point, CV17, conception vessel 17, to address this entire torso chest area. And then I don't have glutathione here. I have it on the other protocol. Is it wrong to add it? No, it's not. You could put it up below the belly button if you want. But what I would say is maybe alternate these 2 protocols. One day do that one day do this one. Now, the only difference here is that the Eon I have here as an optional one, and you could use it during the day or nighttime. If someone has problems sleeping, they're feverish at night, that kind of thing, you may want to use it at night instead of daytime. I just given you an alternate point here. So it is behind the right ear. There's a sleep point called Anmian, right on the bone of the skull. So you can put it there, or you could put it in the other spot we talked about earlier, which is the back of the neck. If you have fever, That would be good to put it back here because that helps to clear heat. So that point clears heat. There we go. So what I'll do too is I'll take these two as pictures and I'll add them to our Facebook group. So you'll have these two pictures so you can refer back to them. Okay, so let me clear all that. Here we go. And I will stop share and then we can address some questions. And while you guys are, let me just let the dog out of it. I guess my husband closed the door so he can't get out. So just bear with me for a moment. All right, we are good. Let me just go and pin you again. Let me see if I can. There you are, Mary.
Hi.
Okay, there we go.
Okay. Somehow I missed Susan's question. I thought, Susan, you had put a question in. I don't see it. Susan Berlin, can you unmute yourself and ask your question? So I know you had one in there, but I don't see it listed here again.
Oh, hi, sorry.
Okay.
The kitchen. Yeah, my question is, I'm taking a really, really strong antibiotic, a clindamycin, something. So I decided today to wear, I'm very new to LifeWave. So and Mary, I got all my things today, actually.
Oh, yay, good.
Yay.
Yay.
But so I was muscle testing to see where to put the LifeWave, whether back here or on the lower point.
X39, you mean?
Yeah, the X39, right, sorry. And so I just decided to put it down sort of below the belly button area. I don't know if it helps the stomach. There's too many things I don't know because I'm brand new to this, but I thought maybe that would help. So that was my question, because it's.
So what was the main symptom? Sorry, I missed that part.
Oh, the potential for stomach upset and diarrhea with this particular antibiotic.
Oh, I see. Yes. Right. Okay. Got it. Well, yeah, actually, that's pretty good. Right. It's inconvenient, but right over the belly button is a really great point as well, but not that comfortable. So covering the belly button is the ideal point in this case if you're, concerned about side effects from the antibiotics and wanting to potentially prevent those side effects. But the point below the belly button, also works well. It's a multifactorial, not multifactorial, multi-gifted point, if you will. It does a lot of things. Now, if, for example, you did get some diarrhea symptoms, what I would want you to do is take either energy enhancers or LifeWave, whichever one you have, and put it on either side of the belly button on the right and left sides of it, just like an inch away. Right. And then you would put your X39 in the center, either on the belly button covering it or just below it, and you'll be creating a nice little triangle. If your stomach, so I'll go ahead and show my little doll here.
Yeah, tell me again where to put the ice waves. I do have those.
Yeah, so if this is the belly button, your X39 will be on the belly button or slightly below it. And then your ice wave would be either side of it, like this.
Okay.
Here, white on right, tan on left. And then if your stomach actually hurts, because sometimes antibiotics will hurt the stomach, you can actually put a third patch, or fourth rather, right over the stomach area. And I would say in this case, an Eon would be good. You'd have Eon, X39, and if needed for diarrhea symptoms, you could put ice wave on either side of the belly button. And again, you don't have to know the points. I mean, I could tell you the points, but you can look it up on Google Images or something, or DuckDuckGo. The points on either side are stomach 25, and the point above is conception vessel 12. Just great for nausea, bloating. It's one of my favorite points actually that I use. I use glutathione there a lot. So that's a great thing. And I mean, hopefully you won't have major symptoms, but it's probably good to prevent them as well. So yeah, so I'd say minimum do the X39.
And do the X39 preventatively. If I start to get symptoms, do the greater protocol?
Correct. Yeah, perfect. That's a great question, Susan. And that's interesting that
Thanks.
you're in clinic, because that's old school. That's
Yeah,
an old school
have
antibiotic.
an,
Actually, I prefer people use that because there's not as much antibiotic resistance.
I have an infection in my gum, so that's why.
Wow. Okay. Okay.
Mhm.
All right. So next.
Okay, we have Johnetta is asking how to help someone with ear pain. And she's
Okay.
also asking, what is the advanced back healing protocol? And Renee wants to know that as well.
Oh, okay. Yes. We'll cover those two things. So for ear pain, one of the easiest things to do, may not work completely, but the easiest thing to do is actually put an Eon patch over the area that has pain. So the most common point to use is behind the ear. Now, normally we wouldn't put Eon on the left side of the body, but when there's pain involved, the polarity, the tissues may change around there, and it may be just fine. What I tell people is try it. If you feel yucky, take it off. So behind the ear is one point. The other point you can use is in front of the ear. Sorry, I got a headset on, so I'll use this guy. So in front of the ear or behind the ear. So just put a single Eon here or here. Now, if it's like, that didn't really help, okay, in that case, you may go and actually use the LifeWave, which is designed for pain, because we need to sometimes move energy past an obstacle. So for example, if it's the right ear that's hurting, you could put a tan patch in front of that ear, and then you could put the white patch back here, or you could do the actual clock protocol that's in the brochure, which would be ideal. But sometimes, taping it up here is not very convenient. But you can try it with the tan patch here and then moving the white patch around until you get a good response. What we're looking for is at least 50% lower in pain. The other way you can do it is you can put the tan one over the pain spot on the right, and then just match it on the other side with the white. And that way you're shooting energy right through the entire head, which may move that obstacle as well, that energy blockage. So yeah, let us know if that helps. So I'm going to go ahead and share my screen. Okay, so let's pull this down so I can see what I'm doing. Okay, so this is our team blog. Oops, pradtrainingteam.com blog. Okay, so this is our team blog. And so once a month, I do a radio show with Dr. Dennis Lobstein, who is an Asian medicine specialist. And he has been working with me, 8 years. We're on completely different teams, but he's just such a wealth of knowledge. So he teaches us a lot of Chinese medicine stuff, not for beginners, okay? Because you might be like, overwhelmed with all the Chinese medicine stuff. You don't need to know Chinese medicine to make these things work well. You just follow the directions, stick it on something, and usually it works. But I'm just going to show you how you go search here if you'd like. So here we're going to see, I think I called it advanced back pain protocols. So we'll do the search here. Okay, here we go. Let's go here, see if this one's the one with the picture. Yeah, so here's the one with the picture. I'll go ahead and put that in the chat so you can look for it later and then, bookmark it or whatever. Now, we did this in the principles of patching as well. So if you are a new distributor or a new customer, just ask your sponsor or whoever you bought it from to give you the link to register for that free training. It's 6 classes, kind of the basics of patching beyond what's in your brochure. And I kind of explain some principles that may be helpful, like how to make triangles, how to make your own formulas, and this is one of the things we were talking about, like an advanced back pain formula. So in this case, we're using LifeWave, white on right, tan on left, and we're using it at the calf. You could also put it on the bottom of the feet if you have any ankle issues. So I think for Mary, we actually said bottom of the feet because she had a swollen ankle, yeah. And then here you actually have the center line. And now, since creating this, we have X39, which is, new. We would probably put X39 right over the pain spot. Carnosine would be slightly higher, glutathione slightly higher, and then eon slightly higher. And here's the thing, if people are like, well, I don't have a bald head, I don't want to put it on the top of my head. Well, you know what? If you're depressed, put eon on the top of your head. And that goes for COVID long haul symptoms as well, right? If someone's down and depressed, put the eon on top of their head. You can use a headband, stick it right to the headband. It goes right through the headband, the energy. So don't worry. You can stick it on a hat. It still works. I just stick it to my head, but I have a lot of hair. So, but if you don't want to use that point, what you can use is this point right here on the back of the neck. Let's see if this will work. Ooh, there we go. All right. So, let me see if I can get it again. There we go. So the back of the head, if you feel the back of your head, the knob, okay, there's like a knobbiness back here, your occiput. If you go to the center line and go to the depression right underneath that, that's governing vessel 16. That clears wind. And so you could put your eon there instead. Again, it might be over hair, but if you want, you can even stack it on top of, the one here on the neck. So, yep. So you can put, whoops. Let me go do that again here. Oh, okay. I think I have to go right on here. There we go. There. So those are some of the other options here. We'll just say what this is. So that's X39 down there. And then here, this could be your alternate for eon up here. Yep. Cool. Yep. So that's your advanced one. But like I said, it's in the principles of patching. So go ahead and, take that training if you haven't already. All right, next question.
Next question is, somebody is curious, Holly is curious about suggested protocols following receiving the vaccine.
Oh, sorry, you said Justin? I missed.
Holly is curious about suggested protocols to use following the vaccine.
Okay, so Holly, did you want to unmute? Because I'll ask you a little bit more questions of what you're looking for. Yes.
Hi there. Yes, I'm here. I'm getting my second shot on Wednesday. That's why I'm asking. And while I'm doing all the things to support my immune system and all of that, I'm very, very new to LifeWave. Just literally put my first patches on yesterday. So I just was curious, since tonight you're talking about COVID, I thought I'd ask that question.
Okay. So is there anything in particular that you would, any symptoms that you wanted to prevent or preemptively?
Interestingly, yeah, I'm sorry to interrupt. Interestingly, I think you covered a lot of them just by talking about the long haul symptoms, because a lot of people have reported things like the fatigue and the headaches and mostly fatigue. And I actually get, interestingly, heart palpitations because of menopause. And you even mentioned irregular heartbeat. So I think you kind of covered it all, like after I'd already typed the question in the chat. But I'm just excited to learn, because even just listening to you talk and your knowledge is just helping me to kind of get acclimated to protocols and processes. So I'm just happy to be here.
Oh, great. Well, we're happy you're here too, Holly. Welcome. Just so you know, the principles of patching training, which is free for all of our folks. I created that not because I wanted you to memorize a bunch of stuff or use a recipe book and brainlessly not think for yourself, right? What the point of that was to really get you to understand how you can use the patches creatively to just kind of know basics, like what are each patch for? Like there's like a minimum amount of things. So then you can kind of problem solve yourself. You can even look up acupuncture points yourself. Like some of the points, like you think that I actually know every single point on this doll, which is not even all the points. Okay, these 300 whatever points. I don't. I know the big ones. A lot of times I have to say, Dr. Dennis, I don't remember where that one is. Can you tell me where it is? Because I don't ever use it. Right. So I'm an acupuncturist and I don't even use all the points. So I think it's curious what you're talking about symptoms though, because I think it's like a media bias or something. I don't know, but it seems like if you so the vaccines are known to, at least in what they've reported, is to decrease severity of symptoms. But some of the symptoms are what are similar to COVID. So it's like, okay, so I'm taking a vaccine to not have a symptom as much, but then if the symptoms come, that means the vaccine's working. So it's just a little odd to me. But aside from that, what we want to do is, one thing we do want to do is that if somebody does get some sort of side effect or allergic reaction, it's most often, at least my understanding with the Pfizer Moderna, is it's after the second shot. Okay, so what we want to do is re-educate the body to go, no, 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 don't react. Okay, don't react. Let the good stuff in, but don't react. 70% of people can have allergic reactions to the pegylated nanoparticles where they deliver the mRNA because they found antibodies in people that, just the average American has seen PEG too much in their diet or their skincare or whatever. So they're already allergic to that. If it were me, I'd be like, can you put in something else that people aren't allergic to? But oh well, it is what it is. So what we want to do is make sure that the body doesn't go into this autoimmune flare up or anything like that. So I would say, as we know, EON decreases stress and inflammation, and it helps the nervous system. And if the nervous system gets upset, it flares up. So one of my cheats, and I can't make a claim or anything like that, but if it were me, what I would do is the day of the vaccine injection, I would double EON patch. We talk about this in the course, so you're more than welcome to take a look at that. And what we do is we do one brain balancing point, for example, behind the right ear, which is a very calming point. The other one goes right over the belly button, hovering the belly button. Why? Because that's an emergency point. So we're literally rewiring that nervous system to go, okay, all is good, stay calm, don't get overexcited here, okay? And maybe Mary, you could share your experience.
It worked very well. I did the EON. Will and I both did that, the EON patch all over top of my belly button and the triple burner 17 behind the right ear. And then we use energy enhancers on our feet as well. And
nice
had very little reaction. I had a couple hours, the 24 hours later, but it was not bad at all.
Okay, great. And that's the other thing too, is you can, even though it's an emergency protocol, and I've used the double EM protocol for people with severe anxiety symptoms, like they're literally jumping out of their skin, they can't function. So, and it helps. So I don't mean emergency meaning you're going to die, emergency meaning like you're just on fire, like your body's on fire. So if you do the double EON, and then we did energy enhancer patches on the feet because it's very grounding. And also it helps to get that energy up, which is helpful for every process in the body to make sure you have enough energy to process whatever you're going through. You can do these multiple days in a row. So if you get your jab on Monday, you can do that Monday, Tuesday, Wednesday, for example, right? You feel nothing, you're like, okay, I can stop, I'm gonna do something else, right?
It is the day of and the day after, and I woke up the next day, I felt perfect. So
perfect, great. That's awesome. Now, if somebody, say, has a very, very sore arm, okay, you could treat that locally. So you could use LifeWave using the clock technique. Normally, for anything acute, which means short-lived, it's not been here for 3 weeks or longer, so a jab is very short-lived. So you would actually put a tan patch right over the bandage. And for the white patch, where do you put that? Well, you could do the clock technique. Okay, so you 12, try it out, 6, 9, do that. Or some people just put it on the opposite side. Just so the energy just goes right across the body. It can't hurt. I mean, if you're just like, ugh, I don't have patience for that kind of stuff, right? You can just put a tan over top and then put the white. You can put the white on the other side of the arm. You could put the white on the other side of the body. It's very, very safe to do that. But what we really want to do is that tan patch is going to sop up that extra inflammation. And if you don't want to do the double EON for whatever reason, you could put an EON patch over there. I mean, we normally don't use 3. So, we usually either single EON here or the double EON here. And I think that's good. And then eventually, just getting, doing that X39 as your foundation. You can do that in addition to the double EONs, but that is going to be the foundation to help your body repair, it actually helps to the GHK copper peptide that it makes, helps to reverse age your 4,000 genes, 300, where did I get that? 4,000 genes. So rewriting your 4,000 genes back to a younger, healthier state. So that could be really, really helpful as well. So I would do that just anyway every day. But on top, you could do these others. Is that helpful, Holly?
That was really awesome. Thank you. I'm really, really excited now.
You're welcome. Yes, please let us know, maybe in the Facebook group, whatever, how you're doing.
I will. I will. Thank you again.
Okay.
So our next question comes from Jim Koska, and he was wondering, he's on Kristen's team, who's on my team, but his wife had some surgery with the ovarian cancer diagnosis, which we're not going to talk about, but her symptoms now are low in energy, indigestion, severe gas, and he was wondering if there was any special patching he could use to help her.
Yeah, you know what? It's actually going to be very, very similar to what we talked about. I would just make a couple of tweaks. So let me go back to my slides here. Nope, not that one. This one here. Yeah, so we definitely want to increase the energy. And so I would probably use energy enhancer patches on the bottom of the feet here. And then she's got indigestion. So we want something on the belly. And I would say probably you could either use, actually, it doesn't really matter. You can use X39, you can use glutathione, you can use Eon. And in this case, I would move that little guy down to that CV12 point here to help with those stomach symptoms. And then I always like the Eon, near the head, because if the nervous system is off, it just takes a heck of a lot longer to heal. So I just like balancing that nervous system. So definitely energy enhancers, probably X39, because we want that to repair, right? And then Eon on the back of the neck would be really good.
Dr. Karen, this is Jim. I thank you so much for your input. I had previously sort of been under the understanding, unfortunately, during this surgery performed, only 90% of what they were going after was able to be gotten at this. Okay. And they discovered 10% more of the same issue on what seems to be the diaphragm area. Unfortunately, they decided not to further pursue that because a chest tube would have had to be inserted, and it was a 10-hour long surgery to begin with, and they didn't want to have the patient to have to go through much more recovery than already what was determined. So what I'm getting at is my initial impression was X39 was something you wouldn't want to use in a situation like this prior to surgery. I think I heard a mention, and I'm wondering if it's something you should consider, since there's still some of the initial problem existing within the body.
Yeah, that's a great question. I know that David's policy counsel is that if anyone has a serious medical issue, that they should run it by their medical doctor, how they feel about it. So because I'm not her medical doctor, I'm not going to, give an opinion necessarily. The GHK copper peptide that the X39 stimulates is very, very different from giving an injection of a stem cell, from umbilical cord or even autologous, which means from your own body, because the GHK copper peptide can make a difference. But I wouldn't want to overstep that boundary of that doctor-patient relationship. So the doctor has to be comfortable with that as well. But definitely after, someone's recovering and they're like, okay, we're done with, treatments for, cancer or whatever. My dad was diagnosed with a kidney tumor, pretty big one, about 3 years ago. And of course, I muscle test, and that's the helpful thing for us energy healers. We can do stuff like that. So I can ask Sora's like, okay, is this for the highest and greatest good? I got yes. So he's been using X39 literally on the tumor. Now, am I going to say that for everyone else? No, he's my dad. Okay, so we're not telling his doctor. But anyway, they don't care. But yeah, so if it's not you, if it's somebody who is they have their own doctor, unless you're a medical doctor, it's probably not a good idea to insist on that. So usually that's why I say to wait. David says to ask the doctor. I say to wait. But I'm just so I have no reservations of using that for that particular, or not for the diagnosis, but even if that diagnosis exists. My dad had kidney chronic renal failure from his diabetes. Of course, the 15 medications that they give him, half of them actually destroy the kidney, right? So I'd rather him not be on it, but diabetes is reversible. But he likes to listen to his doctors, and I get it. So we do the best we can, but he's been using X39 religiously for 2 years almost. The tumor has pretty much stayed the same. He has no metastases. He could use, better energy, but because I can't imagine how I would feel with all those medications on board. Literally, I don't think I would feel any, very good personally. But we do the best we can, and that's all to say that I it doesn't bother me, to use X39 on my own father. But I can't say that for anyone else. In her case, I would say, you know what, skip the X39 just in case, if you're concerned, if the doctor says, nay, I don't want that, and just focus on the energy enhancer patches and Eon, because that is going to be the one, it's going to be still incredibly helpful. And in her case, probably double patching with the energy enhancer patches.
Cool.
Great. That sounds good. I appreciate it. I paid attention. And in fact, when you showed those screens earlier, I was saying, this sounds like what she could probably use to get her going. And so that's going to be the direction we're heading. She has fortunately been very receptive to doing this. The actual location you were asking for the X39 would have been directly on top of her incision, which still has stitches on it right now. So that's another reason why I was saying, oh, wait a minute, do we want to put them on incisions? But I hear what you're saying.
You'd have to put it on top of a bandage or or a shirt. Yeah.
Okay. Well, I'm going to stick with the energy enhancers and Aeon for now. And I think you also had mentioned carnosine as well. And I was using that as well.
Yeah, that's really helpful after surgery for sure. It helps the wound heal much faster.
As I mentioned, the good news is that she's willing to let me give her a try, and she knows that I mean the best for her. So
that's great. Thanks. That's awesome. Very, very safe to use energy enhancer patches and Eon's combination. Another friend of mine, I can't remember whether during the training I showed the gross pictures. I think I skipped those. But anyway, she had a melanoma taken out of her fourth toe, and literally there was a crater there. It was not healing. She's a young person. She's hobbling around for 2 months with a cane, miserable. She's a martial artist as well. That's her hobby. So I met her at a martial arts conference. She couldn't do anything. She was sitting there with her leg on the bench doing nothing and looking miserable. And I said, why are you still using a cane? And she's like, well, I had surgery 2 months ago. I'm like, yeah, but why are you still, And she said, well, it's not healing. And I said, oh, I said, can I see it? Do you mind? She's like, oh yeah, I wanted to show it anyway. Here's some pictures. So she took a picture every single day, I think. And it looked horrible. It was like this big crater. It was not healing. The surgeon said, oh, I may have to skin graft you, but it's just not. So she went through 2 rounds of antibiotics, no change, nothing, right? And I just instinctively said, you need X39 and you got to start them now. And I'm normally not that forceful. She's a friend of mine, right? She's like, but she's also open because she's an osteopath. She says, I'll try anything. I'm miserable. So from the first day, she said, I feel energy going on my foot. This is kind of interesting. By the next day, she was smiling for the first time and was up kind of play fighting a little bit with her boyfriend, with the sticks and stuff like that. And she would take a lot of rests, and she was, still had the 1 foot, with the bandage on it. But I told her to make sure she took pictures every day, and she did. So in 7 days, it healed over, and it was a miracle. Her surgeon was like, wow. He says, whatever you're doing, just keep doing it. So she used them, I think she had 10 days of patches, and that was it. Like, I kept saying, don't you want more? Like, she said, no. So that's all she did. She used 10 days of patches, and literally after 2 months of not working, couldn't drive because that was the foot she used to drive, right? Mm-hmm. The accelerated pedal. She went back to work in 14 days. Wow. After 2 months of missing work and having to be driven everywhere. That is how amazing this is. Now, was I taking a chance because she had, cancer as a diagnosis? I'm like, well, if GHK can, make the genes happier, why wouldn't I do that? But of course, she was a friend, a trusted friend. She trusted me. So I just knew that was going to help her, and it did, because there was really nothing else that was, she would have had to go back into surgery, into surgery, into surgery, into surgery. And I was just like, no, you're doing this. And she agreed. So just wanted to give some folks some inspiration there with that story.
We have lots more questions, and I know our time is up.
Yeah, so let me take a look at our time here. So let's take 2 more questions. And then just so you know, guys, if you're on the team, we have a Q&A pretty much, once a week. Like, it's 4 times. The first Tuesday, and then the second week is, Mary's, and the third week's Anna's, and then Gretchen's the 4th week. So we have them kind of scattered around. And then once a month, the first Monday of the month, we have Dr. Dennis on my radio show. And that's for the whole of LifeWave, everybody, not just our team. So we take questions from all over. So there's like 5 opportunities, a month to get some help. And then if you're, in the Facebook group, you can always tag me or tag us, and we can help you out there as well. But I really want you to take that Principles of Patching program, because a lot of the basic principles you'll kind of start understanding. Oh, make a triangle. Okay, so if I have this symptom, this is the patch that, if I have this symptom, this is the patch I want to use, right? So it's not just about me regurgitating as a acupuncturist what you should do and you just listening to me. That's not what I want. I want you to be empowered to figure this stuff out yourself, because it's actually not rocket science.
So there's one question here that was asking for a protocol for no feeling in the front half of feet, and that was from Joe Torres.
Okay, Joe. All right, awesome. So, so the top of the foot, or the whole, this part here, Joe. Can you unmute?
That would be the front part of the bottom of his feet.
Oh, here?
Yeah, and then it's painful towards the back. This
More
is another
painful.
guy I got. So just all the way in the front. And let me clarify that. It's the front of his foot, top and bottom, no feeling.
No feeling here.
Yeah.
Okay, and some pain down here.
Yes, and towards all the way to the back.
Whitney, did you log in?
Okay, great. What we need flow, because in Chinese medicine, anything that's painful or numb, that means there's no flow. So the best thing to do is ice wave on the bottom of the feet. Now, it may not be overnight, but it would be a good point to try. The other point you could try is ice wave on the top of the feet on liver 3, because liver 3 is really good for moving energy and blood. And so liver 3 is between the first and second toe around here. And then kidney 1 is the one we showed earlier here as well. And there are some fancier things we could do, but, for example, carnosine can be really useful, X39 for sure. And we would probably just put those in the center line and then treat the actual foot issue with the ice wave. So you make a nice big triangle in the body.
Okay. Anything with X39?
Yeah, so that would be in the center of the body. So we would use that either on the belly or on the back of the neck.
Okay.
Yep.
All right.
And then use the ice wave, and we hope that helps.
Sounds good. Thank you.
All right. You're welcome.
Trying to pick another question, but I'm not finding one. How about
Sue says, how about to get in your Facebook group? Yeah, so you can go ahead and talk, Mary, if you want. I'll just go ahead and find that.
Okay. Yeah, I had not sent them to you, Susan. I meant to do that. If you know someone who has problems with growths in their uterus, which are growing, and they want to avoid surgery if possible, is there anything you could recommend for that? And that was Wayne asking that question.
Okay, well, yeah, definitely. It depends on, how they feel in terms of their diagnosis. So because I'm not their doctor, I can't necessarily say this is for sure what they should do, but what I can tell you is that if you have a non-cancerous bleb or tumor, it usually means your spleen channel is out of balance. So when your spleen channel is out of balance, you create dampness and phlegm. In Chinese medicine, phlegm includes tumors. And I was one of these people, very damp. And that's my tendency, is damp. So I'm not a big fan of humid weather. Rainy weather is better, but humid weather, definitely not. And so I had a big tumor in my breast. It was benign. And some people will have cysts, fibroids, like all sorts of benign tumors. And so we definitely want to treat the spleen channel. And I like to use energy enhancer patches on spleen 6. So white on right, tan on left as kind of a core issue. The uterus itself, spleen 4, is really helpful as well. So spleen 6 is up on the inside of the leg. And spleen 4 is right about here. So spleen 6 is a little higher up on the inside of the leg. So about 4 finger widths up from here. But spleen 6 is like one of the most powerful points, acupuncture points, that almost all acupuncturists use like almost all the time. So spleen 6 or spleen 4, white on right, tan on left with energy. And then as far as potentially shrinking something that's swollen, LifeWave clears obstacles, right? And so when phlegm is accumulated, in Chinese medicine, phlegm's accumulated, we would actually put needles near that area to move the energy. So I had one gal one time, she actually used LifeWave patches on either side of the uterus, and then an eon on the center, and that seemed to help with that. But you need to treat the constitutional issue, which is the spleen channel not being happy. So I would say also go to an acupuncturist, because there's multiple constitutional things that maybe, herbs might be helpful, other acupuncture points might be helpful, but as a basics, I would definitely use spleen 4, spleen 6, and then, make a nice little triangle, if you will, on the belly, where you have the LifeWave, white on right, tan on left, and then you have an eon kind of right above the pubic bone. Let's see if I can share. See if I can make that for you here. So, so just ignore, so let me go ahead and make, oops. Sorry, what did I do? I think I messed up the screen sharing. I have to go to the right slide. There we go. Okay, now I'll go screen share again. Okay, there we go. Now I can move things around. So this little guy might be moved to spleen 4. We'll move this one to spleen 4. We'll say this is LifeWave. White on right, tan on left, and then the eon right in the center here. So just ignore all that kind of stuff. So that's what we would be working on. So again, LifeWave on the belly here. White on right, tan on left, eon on the center, and then energy on the spleen 4 down here would be a nice little protocol for that. And just, you can ignore all this other stuff up here.
Cool.
All right, so, okay. So let me just undo all of that. There we go. So I'll save this picture for you and I'll put this on the Facebook group. Yeah, and just be careful about sharing this publicly because you can email it to your colleagues, friends, whatever, which is fine, but we don't want it publicly floating around so that the corporate compliance might be like, what are you talking about? I didn't put the word COVID in here, luckily, but we just don't want people to go, oh, that's the formula, and I'm just going to use this formula, right? We want you to understand that, hey, these are just suggestions. So you could, alternate between restoration protocol 2, restoration protocol 1, and just kind of go back and forth and see what works. If it doesn't work, you can try different points. So it can be flexible.
Awesome.
Okay, great. Thank you, Mary, for hosting. This was fun.
Thank you, everybody. It was fun. Great group of questions and people tonight. Yahoo!
Yeah, woohoo! All right, and so this is saved on the. There's a secret link from the Patch Training Team Facebook group to the replays or all of our Q&As, and the link of course is also in the chat. If you want to review this later, just notice it's going to be unlisted because because you didn't all give me permission to. Because we did, we went outside of, what we normally talk about, with LifeWave and corporate and stuff like that. So that's why it has to be unlisted. All right. Thanks, guys. We'll see you soon. Take care. Thank you, Mary. Bye.
All right. See everybody.